Hello everyone, welcome back to Diabetic 365. Today, we're discussing a crucial topic affecting millions: diabetes. We all know the common signs like increased thirst and frequent urination. But did you know there are unusual symptoms that can also point to diabetes? In this video, we'll explore 12 unusual symptoms that may indicate the presence of diabetes. Let's get started. 1. Darker skin on the neck, Acanthosis nigricans. First on our list is an unusual skin change, darkening of the skin, particularly around the neck. This condition is medically known as Acanthosis nigricans. You might notice these dark patches are widespread, or sometimes they appear just in the creases of your skin. The affected skin can also feel a bit velvety or thicker to the touch. While the neck is a common spot, these dark patches can also develop on other parts of the body, including the armpits, groin, and even areas like the elbows and knees. Acanthosis nigricans is frequently seen in individuals with type 2 diabetes and those who have prediabetes. It's also more common in people with darker skin complexions. Here's why it happens. In type 2 diabetes or prediabetes, your body's cells become less sensitive or resistant to insulin, the hormone that helps sugar enter your cells. To try and compensate for this resistance, your pancreas starts to produce more and more insulin. These high levels of insulin in your bloodstream then cause skin cells to reproduce at a faster rate than normal, which leads to the characteristic darkening and thickening of the skin. It's important to remember that while Acanthosis nigricans is strongly linked to diabetes, it can also be a sign of other underlying conditions. These include obesity, certain hormonal disorders, or even side effects from some medications. Therefore, if you notice any unusual skin darkening, it's crucial to visit a healthcare provider. They can correctly determine the underlying cause and guide you on the appropriate next steps. 2. Unexplained weight loss. Next, unexplained weight loss can be an unusual sign of diabetes. This is especially true if diabetes is not yet diagnosed or not well managed. This kind of weight loss often shows up in people with type 1 diabetes or in those with type 2 diabetes that isn't under good control. Why does this happen? Your body normally uses glucose, sugar, from food for energy. But with diabetes, your body can't use this glucose effectively. Because it's not getting enough energy from sugar, it starts breaking down other things for fuel. It begins to break down your fat and muscle tissues to get the energy it needs. This breakdown of muscle tissue is also called muscle wasting, or muscle atrophy. When your muscles waste away, it leads to overall weakness and, of course, more weight loss. So if you're losing weight without trying, and you're not on a diet or increasing your exercise, it's a symptom worth noting. 3. Lightheadedness. Feeling lightheaded? In people with diabetes, this often signals low blood sugar, known as hypoglycemia. This occurs when your blood sugar level drops below the normal range, typically under 70 milligrams per deciliter, mg/dl. Several factors can cause hypoglycemia: taking too much insulin or other diabetes medications, skipping meals or not eating enough carbohydrates, engaging in intense physical activity without adjusting your medication or food intake to match the energy burned. So, why does lightheadedness happen during hypoglycemia? Your brain relies heavily on glucose for energy. When your blood sugar levels drop too low, your brain temporarily doesn't get enough glucose. This lack of fuel to the brain causes the feeling of lightheadedness. If you experience lightheadedness due to hypoglycemia, you need to act fast. Immediately consume a fast-acting source of glucose, such as fruit juice, a few pieces of hard candy, or glucose tablets. These quickly raise your blood sugar levels and help relieve the symptoms. It's also very important to follow up with a balanced meal or snack afterward to help stabilize your blood sugar for a longer period. It's worth noting that high blood sugar, hyperglycemia, can also lead to lightheadedness in severe cases. This can happen when blood sugar levels are extremely elevated, leading to significant dehydration. In some instances, it can progress to a serious condition called diabetic ketoacidosis, DKA. DKA is a medical emergency that can cause symptoms like lightheadedness, nausea, and vomiting, and it requires immediate medical attention. 4. Changes in vision. Vision changes can be a diabetes symptom often related to diabetic eye disease. These changes include blurry vision, common symptom. Fluctuating blood sugar can swell your eye's lens, causing temporary blurry or hazy vision and focus problems. Frequent prescription changes. You might need new glasses or contacts more often as blood sugar changes affect lens shape. Cataracts. Diabetes raises your risk of getting cataracts younger. Glaucoma. Diabetes also increases glaucoma risk, which damages the optic nerve and can lead to vision loss. Diabetic retinopathy. This is a major concern. It damages blood vessels in the retina, the part of the eye responsible for vision. If untreated, it can lead to vision impairment or blindness. Consult your doctor if you experience any of these vision symptoms. 5. Sexual dysfunction. Sexual dysfunction, like erectile dysfunction, ED, can be a diabetes symptom. ED typically affects males with type 2 diabetes, making it hard to get an erection. High blood sugar damages nerves and blood vessels, carrying blood to the penis. Sexual dysfunction can also affect women, leading to lower arousal and poor lubrication. However, research on women's sexual issues related to diabetes is less conclusive. 6. Frequent infections. Frequent infections can indeed be an unusual diabetes symptom. They often happen because diabetes impacts the immune system. Poorly controlled diabetes weakens your immune system's ability to fight infections. High blood sugar hurts white blood cell function, making it harder to fight bacteria and viruses. These frequent infections can include vaginal infections, yeast infections, urinary tract infections, UTIs, skin infections, respiratory infections like pneumonia and flu. People with diabetes may also take longer to recover from infections due to a weakened immune system and high blood sugar affecting healing. 7. Irritability. Irritability in diabetes often comes from fluctuations in blood sugar levels, both very high, hyperglycemia, and very low, hypoglycemia. Blood sugar can affect mood and emotional well-being. The mix of low sugar and extreme hunger can make someone feel irritable and impatient. 8. Dry skin and itching. Dry skin and itching are often linked to diabetes affecting the body's ability to hold moisture. Consistently high blood sugar can make skin lose moisture faster, leading to dryness and flakiness. Itching often comes with dry skin and can be bothersome. It can happen anywhere but is common on the lower legs, feet, and ankles. Some diabetics develop diabetic neuropathy, which affects nerves. Neuropathy can cause abnormal sensations like itching, tingling, or burning in the skin. 9. Fruity-smelling breath. Fruity-smelling breath is a lesser-known but critical diabetes symptom. It occurs when blood sugar levels are extremely high and is a hallmark of diabetic ketoacidosis, DKA. DKA is a severe, life-threatening complication, most common in type 1 diabetes, but it can also occur in type 2. DKA happens when there's a severe lack of insulin. Blood sugar rises dangerously. Without enough insulin, body cells can't get energy from glucose. So, the body breaks down fat for energy, producing ketones. These ketones build up in the blood, making it acidic. This causes a distinct fruity or sweet smell on the breath, like acetone or overripe fruit. DKA requires immediate medical attention. 10. Dry mouth. Dry mouth is often linked to changes in saliva production and diabetes' overall impact on oral health. Several factors contribute. High blood sugar can affect salivary gland function. Frequent urination in diabetes can lead to dehydration and dry mouth. Some diabetes medications can also cause dehydration and dry mouth. All these factors can result in dry mouth in diabetics. 11th, pain in your limbs, diabetic neuropathy. Pain in the limbs, often called diabetic neuropathy, can be an unusual symptom. This condition affects the nerves, causing various types of pain and discomfort in the arms, hands, legs, and feet. The exact cause isn't fully understood, but it's linked to prolonged high blood sugar, inflammation, and changes in blood vessels that nourish nerves. Pain associated with diabetic neuropathy can appear in several ways. Peripheral neuropathy, the most common form, causes burning, tingling, or shooting pain in hands and feet. Proximal neuropathy causes pain in thighs, hips, or buttocks. Can lead to leg weakness. Focal neuropathy affects specific nerves, causing localized pain, for example, wrist pain. Autonomic neuropathy affects nerves controlling automatic functions, heart rate, digestion, blood pressure. Can lead to symptoms like digestive pain. 12th, nausea and vomiting. Nausea and vomiting are other symptoms that may indicate diabetes. Both can occur due to neuropathy. Nerve damage can prevent food from moving properly from the stomach to the intestines. This backup can cause nausea and sometimes vomiting. Extremely high blood sugar can lead to increased urination and dehydration, which in turn can cause nausea and a general feeling of illness. In diabetic ketoacidosis, DKA, nausea can come with vomiting, abdominal pain, and confusion. Nausea can also occur when blood sugar drops too low, hypoglycemia, though hypoglycemia more commonly causes shakiness, sweating, and confusion. Some diabetes medications also list nausea as a side effect. These are 12 unusual symptoms that could indicate diabetes. Remember, early detection and management are key to good health. If you or someone you know experiences any of these symptoms, please seek professional medical advice. Thank you for watching. If you found this video informative, don't forget to give it a thumbs up and subscribe to Medina's for more health-related content. Stay healthy and take care.